Does running in pregnancy mean that you're going to be more likely to run in postpartum? All right, we took a look at this article from 2021 from Izzy Moore, who's also been on the podcast. Check out her episode, May 2023. And basically they were looking at this in the context of stress urinary incontinence. But the general conclusion was that running during pregnancy may assist women safely in returning to run postpartum. And what they found was continuing to run during pregnancy and having a high weekly running volume pre-pregnancy increased the odds of returning to run postpartum. So if you've got a high mileage pre-pregnancy and you're running quite a bit in pregnancy, you're more likely to return to run in postpartum. Having a high weekly running volume increased the odds of postpartum return to run, but it decreased the odds of returning to pre-pregnancy running level. They noted that this may reflect high volume runners following clinical recommendations and gradually returning to running, so coming back a little bit slower. And additionally, women who took longer to complete their first run following childbirth and those with only one child had lower odds of returning to pre-pregnancy running levels within 12 months, which kind of makes sense. Further supports the indication women are gradually increasing running volume and could also suggest that prior postpartum experience is beneficial to recovery. All really interesting points. Last one here, a limitation. They said weekly running volume was reported pre-pregnancy and postpartum, but running intensity was not. Therefore, although runners may have returned to pre-pregnancy running volume, they may not have achieved a similar level of performance. So what does all of that mean? Is if in pre-pregnancy you're doing a lot of mileage and then you're able to maintain that during pregnancy, it does increase the likelihood that you would be able to run in postpartum. And so, I mean, barring any other things that you see here in the graph, like pelvic heaviness, pelvic pressure, those sorts of things. So my question is this, because most of us are middle of the pack runners or back of the pack runners, is, you know, does this mean that if you ran a lot and you're more elite, you're more likely to get back, but those of us in the middle, maybe not so much? And so, of course, like any good study, there like more research is needed. But to me, as a runner, as a provider, I'm like, if you're not having any issues running in pregnancy, it is going to increase your likelihood of hopefully not having any issues in postpartum. But then again, how many people are able to do that? And again, as pelvic floor PTs, we want moms to be more active. We want them to be able to run longer in pregnancy without sciatica, without pubic bone pain, without leakage or heaviness or pressure or things like that. But tell me about your experience in running in pregnancy, and was it okay in postpartum?